Hello everyone, this is Dr. Ankita Singh, Reader, Department of Oral Pathology and Microbiology, Babu Banarsidass College of Dental Sciences, Lucknow. Today's lecture is on non-keratinocytes. Non-keratinocytes constitute 10% of oral epithelial cell population. They are present in both keratinized and non-keratinized epithelium. As they lack desmosomes except Merkel cell, during histologic processing, the cytoplasm shrinks around the nucleus to produce a clear halo. Thus, they are called clear cells. They lack tonofilaments. From ultrastructural and immunochemical studies, they represent a variety of cell type. They include melanocytes, Langerhans cell, Merkel cell, inflammatory cells. They lack desmosomal attachment except Merkel cell. Melanocytes, they are melanin pigment producing cells. Origin is neural crest cells. They migrate into basal layer of epithelium. They are self-replicating. They lack desmosomes and tonofilaments but have long branching dendritic processes. They contain ovoid melanin containing organelles, melanosomes. Melanosomes sometimes engulfed by connective tissue macrophages, melanophage. So in this picture, we can see melanocytes with melanosomes. Melanin is synthesized by melanocytes using enzyme tyrosinase, and they can be stained with silver stain Masson-Fontana. They demonstrate tyrosinase activity histochemically. Lightly and darkly pigmented individuals have the same number of melanocytes in any given region of skin or oral mucosa. Melanocytes appear as clear cells in hematoxylin section. They have spider-like appearance with silver stain. They are present in gingiva, buccal mucosa, heart, palate, tongue commonly. Langerhans cells now considered as macrophages derived from bone marrow. So these Langerhans cells, it leaves the bloodstream, enters lamina propria, penetrates basal lamina to reach the epithelium. These are clear or dendritic cells with no desmosomes or tonofilaments. They appear clear due to lack of desmosomes. And they are characterized ultrastructurally by vacuolated nucleus and characteristic rod or flask shape longitudinally striated granules called Berbick granules. So in this picture, we can see the Berbick granules. These granules have marked adenosine triphosphate activity. Cell membrane of Langerhans cells show ATPase positive reaction. Langerhans cells have an immunologic function as antigen presenting cells, and they recognize antigens entering epithelium from external environment and engulf them. Intracellular lysosomes present in Langerhans cells split the antigens into peptide components. These fragments are then transferred and presented to T lymphocytes either locally or at lymph nodes. Langerhans cells migrate from epithelium to regional lymph nodes to present the fragments of antigen to lymphocytes, help epithelium of oral mucosa interact with entire lymphoid system to mount immune response. And they can be demonstrated using metal impregnation techniques, gold chloride and osmium zinc oxide. In this picture, we can see Langerhans cells form a network in the epidermis. Merkel cells, these are disc-shaped, non-dendritic terminals of myelinated fibers that have shed the Schwann cell sheet. They are located in basal layer of epithelium close to nerve fibers, previously thought to arise from neural crest cells. Merkel cells are non-dendritic. Recent evidences indicate epithelial origin. It has occasionally keratin tonofilaments and also contacts adjacent cells through desmosomes. So Merkel cell does not always resemble other clear cell in histologic sections. In this picture, we can see the Merkel cell. Ultrastructurally, fine filaments are present, numerous mitochondria and electron-dense membrane-bound granules in cytoplasm, which is seen in close proximity to nerve fiber associated with the cell. These granules may liberate a transmitter substance across the synapse-like junction between Merkel cell and nerve fibers generating impulse. It suggests that Merkel cells are sensory and respond to touch. They have nucleus which shows deep invagination and characteristic rodlet appearance. These cells are more seen in masticatory mucosa such as gingiva. Then there are inflammatory cells. A number of inflammatory cells can be seen in various layers of epithelium. These cells most commonly seen is lymphocyte, which are closely associated with Langerhans cells, although polymorphonuclear leukocytes and mast cells are also present. They may be present anywhere in mucosal cell layers, possess no desmosome, no tonofilaments, with large circular nucleus and scanty cytoplasm. These cells are transient and do not produce themselves in epithelium like other non-keratinocytes. So that's all for your lecture. Thank you.